Hey guys, Ashley with Amare. So we're going to start our videos today, and the first thing that we're going to start on is kind of the same thing we covered in the YouTube video. So what is manual lymphatic drainage? So there's tons of things that answer that question. Manual, which is done with the hands, done manually, a pumping motion on the skin, lymphatic drainage to drain the lymph system. So no fluid ever leaves the body, number one. Number two, everything is internally. And number three, it's extremely gentle. So looking at my hand here, it is a placing of the hands and a gentle pumping motion used to move the skin so that you are dilating the lymph vessels, moving the fluid underneath the skin. So it's literally just a very, very gentle, light motion. So anybody that tells you lymph drainage is like scraping or rubbing or like deep pressure, that's not what it is. And that's not going to do anything to the lymph system. That's dealing with tissue, that's dealing with muscles, but that is not directly dealing with the lymph system. Lymphatic drainage should be extremely, extremely gentle, which is why we do it 48 hours post-lipo or a week post-op tummy tuck or anything that requires swelling like that. It's meant to be fragile. We also use it on autoimmune patients, Lyme patients, cancer patients, because again, it's super, super gentle. So that's what it actually is. It's a massage. It's categorized as a massage technique. It's a pumping motion done on the skin to get the fluid to move through your system and through your body. So where does the lymph fluid go? So it has its own system. It runs just beneath the skin all the way down deep to the bones, in the organs, in the lining of the tissues. But the best way to get it is at the skin, right at that level with that gentle little pumping motion. So lymph vessels are all over the place. Lymph nodes are in your neck, your armpits, and your hips. Those are your major drains. So an actual lymphatic drainage therapist that knows what they're doing is going to guide the fluid through the body, through those little vessels with that pumping motion towards the lymph nodes and towards the drains so that it drains into the body, it gets reabsorbed, it goes through your kidneys, gets filtered, and comes out through your urine. So lymph drainage is excreted through the body and expelled out through your urine, and it doesn't come back once it's out. It's a one-way closed pumping system, unlike your circulatory system, which allows blood to go kind of all over the body and cycle back and has its own pump. The lymph drainage does not have its own pump. Your lymph system doesn't have its own pump. So any lymph drainage that your body does normally on a regular basis is done by full body musculoskeletal movement. So basically picking up your body and moving it in abstract ways. Dancing, yoga, swimming, all those kinds of things that are abstract movements. Linear movements, just up and down and side to side, don't really do as much. They do help, but it's not as effective. You want a lot more broad movement than that. So that is what lymph drainage is and how it's moved in the body and what it does. A manual lymph drainage session is supposed to be just hands-on of that gentle pumping motion, full body. So if you only do one section of the body with lymph drainage, just that one, like one arm or one leg, you're kind of just moving fluid out of the area, but you're not helping the whole body. So you need to implore all of the lymph vessels to get your entire body to drain the fluid back. Otherwise, it's kind of just going to creep back into that area. So we do full body every time with spending more time on areas that we're concentrating on, like for a tummy tuck around that tummy tuck scar or the dog ear area on the sides of the body, or for liposuction wherever you had the liposuction done. So it really depends on where we need to focus on, where we had the work done. So each lymph drainage session is full body, but every single one is tailored a little bit differently to what you need using that same gentle pumping motion. And again, it's super, super light, super gentle, and it's just a little bit of movement of the skin. We're not working with bones, tissue, anything like that. There are no rollers, there's no heat, there are no machines, there's nothing external at all. The lymph fluid should never leave the body. It should never come out of the body. Usually when it comes out of the body, it's things like weeping wounds that you get from lymphedema patients or patients who have really big limbs where their wounds start to weep or start to leak. Sometimes that'll happen if your doctor or your surgeon leaves your incisions open after lipo. That's for your body to kind of like get rid of the pressure, and it'll weep a little bit. Once we start the lymph drainage, and instead of the fluid trying to escape your body, it gets sucked back into your body, those weeping wounds close up in about a day or two or 1 or 2 sessions depending on how we're doing them. So that's a little bit about lymph drainage. Again, MLD, manual lymphatic drainage, should be just hands-on, gentle, light pumping motion, no pain. You shouldn't have to take medication beforehand. It should be super, super gentle. If you are going someplace that's doing lymphatic massage, claiming to cut open your incisions and rake fluid out of you like you constantly see on Instagram, or sticking needles in you and sucking fluid out, aspirating things, it's not real true lymph drainage, and it's not really going to work to the magnitude that true lymph drainage promises to work. So definitely be educated on what it is first. Hopefully this video helped you guys, and you can contact us anytime through DM, email, go to our website. All the information is in the link in the bio. So go ahead and check us out, check that out, and I hope this helped you guys so much. Enjoy the rest of your day, and I'm so excited to start talking to you guys more. Bye!